Our goal is not only for Cincinnati Children's to provide the best care to an injured kid, we want all injured kids to have the best outcome possible. The Pediatric Trauma Transformation Collaborative is our effort to really help educate and partner with other hospitals to make sure injured kids are receiving the best care possible. The idea came from some of the folks at the American College of Surgeons who suggested to St. Mary's, who was our first partnering hospital, that they talk to us about how to improve their pediatric trauma program. Fill some stuff in.
St. Mary's and Cincinnati Children started the collaboration in 2007 when, to be re-verified as a pediatric trauma center, it was then a requirement to have a pediatric surgeon. We did not have a pediatric surgeon on staff at the time. We have a group of adult trauma surgeons who care for our pediatric patients, but with this new requirement, we took an alternate pathway to get a pediatric surgeon off-site.
We established a relationship where they would act as our pediatric surgeon and act as a director of the performance improvement program, which is key to achieving verification.
The process for the program is really, like the name says, it's collaborative. So we learn from them, they learn from us as well. Same flow sheet, regardless. So there's several phases to it. Our simulation training is really focused on teamwork and communication around pediatric trauma patients. We run them through trauma simulations, patients that are really modeled after our patients. We've even used patients that they've seen in their emergency room and developed simulations directly around a patient that they really saw. So it's not just a made-up scenario for them.
When we learn processes here, it energizes our staff to take them back to our organization and make change, implement change in things that we do for our pediatric population, improve care for our pediatric population, and overall improve the patient experience.
There's a natural reluctance to change, and that was the way it was in the beginning. But after the ball got rolling, after we brought a few people over, after we infected a few, then it was a parade. Now we have a waiting list of people who want to come to Cincinnati.
Another piece is we help with their trauma performance improvement process. So they will review cases. I will link to them via video conference most of the time. And then during that meeting, which is their multidisciplinary trauma team meeting, go over issues and opportunities for improvement.
The whole concept of trauma is based on a trauma system plan, getting the right patient to the right place in the shortest amount of time. What the relationship with Cincinnati has allowed patients that can stop with us to stop with us. Patients that historically would have been shipped out of Evansville to a higher level of care no longer shipped. And that has greatly improved not only the patient care, but life for the family.
And the final piece is we're available really 24/7 for if they have a patient that they have questions about, concerns about, they can reach us by phone. We can get online, look at some of the images if we need to, go over plans with them.
I think it's going to change the way we do trauma care in this country because there aren't enough pediatric surgeons. And if you don't have enough pediatric surgeons, then you need to create a bond, a bridge to a facility that has the best. And Cincinnati is one of the best in the world. I think any hospital that wants to be a pediatric level 2 trauma center should jump at the opportunity to join with Cincinnati Children.
We are now verified as a pediatric trauma center via the alternate pathway with Cincinnati Children's for a pediatric surgeon component. We were just reviewed for the second time using this model, and our reviewers had nothing but positive things to say about the collaboration and the relationship and the benefits that we had received from our relationship with Cincinnati Children's.
I've been a professor of surgery at 2 different medical schools. I've been a vice chairman. I've been to war. I led my unit in Desert Storm. And yet this thing that we've accomplished at St. Mary's is as big an accomplishment as anything I've ever done.
Our goal is not to take over people's trauma programs. Our goal is to make sure kids get better and have the best possible outcome they can.